We are seeing alarming levels of influenza across the country. According to the CDC, flu cases are the highest they've been in 15 years. That has driven overall levels of respiratory illness to very high for the first time this season. Dr. Nidhi Kumar is on call to tell us more about this and the warning signs you need to look out for. Good morning to you, doctor.
Good morning.
How does this flu season compare to previous ones?
I mean, this is the worst flu season we have seen in several years. Everywhere you listen, people are coughing. Schools are being closed down across the country. Now, flu season started early this year, so that's contributing to it. And we have 2 to 3 months left of this. The circulating strain of influenza this year is influenza A, and that tends to be more aggressive. And then vaccination rates were down this year, according to the CDC. Less children were vaccinated this year as compared to previous years. You put it all together, and people are getting sick.
What are some of the emergency warning signs to look out for to determine whether you have the flu in both adults and children?
Well, flu can be quite dangerous, and the two complications with the flu are low oxygen levels or severe dehydration. Now, this is going to present differently in children versus adults. So for adults, if adults are experiencing chest pain, abdominal pain, severe muscle pain, if they are acting disoriented or unsteady or confused, you really want to seek medical attention right away. And then for children, presents a little differently. Young kids can look bluish in the face, bluish lips even. Young children may not act alert. They may not act like themselves. And if they have too high of a spike in fever, young children can experience seizures. So if you're seeing the suggestion of any of these changes, it's important to reach out to a healthcare provider immediately.
There have been many different viruses circling around this winter. Can you discuss how to tell the difference between the flu, COVID, and just the regular cold?
Absolutely. So cough, stuffy nose, sore throat. If your symptoms are pretty much limited to those three, think common cold. But once you get into the territory of fever, severe fatigue, real muscle aches, well, then we're thinking of something more severe, and that's going to be COVID or the flu. Now, two symptoms that are present in COVID, we don't really see them with the flu, are diarrhea or loss of taste and smell. So if you're experiencing those symptoms, probably dealing with something like COVID, but here's the thing, there are at-home tests that can test you with one nasal swab to see if you have flu or if you have the COVID. They are readily available in pharmacies, so when in doubt, just take a test, but no matter what, stay home, because you don't want to give this to someone else.
And is it too late to get the flu vaccine at this point?
Absolutely not. I mean, we have 2 to 3 more months of this flu season because we started earlier. So go get the vaccine. The CDC recommends getting vaccinated for anyone over the age of 6 months. Seniors over the age of 65 can even get a high potency flu vaccine. But at the end of the day, go to your healthcare provider or your local pharmacy and get whatever vaccine they have, because it's going to prevent severe infection and it's going to prevent hospitalization and prevent the spread.
Dr. Nidhi Kumar, thanks so much for joining us. We appreciate it.
Thank you.
And you can catch Dr. Kumar's health reports every Monday at 7:15 right here on CBS News New York.